Couple of years ago, my elder sister, she's a pathologist, she told me a terrifying incident that took place in the hospital she is working at. Now, before getting into that story, let me warn you, this might be disturbing for any of us. A patient having complaint of nasal polyp came into the hospital to get rid of the problem. This patient visited an ENT surgeon, and after the consultation, this patient was scheduled for a nasal polyp removal procedure. It was a relatively simple procedure, supposed to take 20 to 30 minutes. But things went wrong that day. It took more time. There were much more bleeding than expected. Unfortunately, it ended up in the death of that patient. The tissue sample that was taken from that patient was sent to my sister for examination, and what she saw under that microscope is beyond our wildest guess. Fragments of brain tissue in what was supposed to be nose. That's right, this surgeon went all the way up and nipped a portion of brain, and the cause of death is bleeding due to brain damage. Let me tell you something about that patient. He was young, late 30s, he had 3 kids, and he was the only breadwinner for a 6-member family. Unfortunately, incidents like this are not rare as we would like them to be. I'm coming from a family of doctors. I myself is a doctor. My elder sister, as I told you before, is a pathologist. My brother-in-law is a pediatrician. My dad is a psychologist. And whenever I get around dinner table with my relatives, I used to hear such incidents every now and then. In fact, when we look into the literature, it says there are more than 250,000 cases of death per year here in United States due to medical error. This is a study carried out at Johns Hopkins University and published in British Medical Journal, or BMJ, in 2016. It also says it's the 3rd most common cause of death right after heart disease and cancer. It's a global problem, much more worse in different parts of the world. When we think about the multitude of problems posed by field of medicine, we often think about overworked doctors, tired staff nurses, monopolizing pharmaceutical industry. However, there is this one person among all allied health professionals whose effect is seen all throughout. Might not be well recognized and famous though. This person is an interface between medical educator in a med school and a student. Later, an interface between doctor and patient, an interface between pharmaceutical industry and public, even an interface between doctor and jury when it's required. This person is a medical illustrator, and I am a medical illustrator. I heard that tragic incident that my sister told me when I was pursuing Masters in Medical Illustration here in Rochester Institute of Technology. And I started wondering, is there anything I could do about it? Is there anything my profession could contribute in order to bring down this problem or such terrifying incidents? Now, when we talk about medical negligence, medical error, it's a big problem with wide variety of reasons and solutions. However, when it comes to subject and skill matters of health professionals and related areas, medical illustration could play a role. Let me show you different possibilities. Medical education. How could medical illustration play a role in medical education? In fact, skill or improvement of skill of healthcare professional is one of the solutions discussed in BMJ journal. Skill means knowledge and experience. In other words, medical education and training. Let me show you how medical illustration can play a role in medical education. Let me talk from experience. I have had a subject called human gross anatomy, which deals with structures within human body back in my med school when I was doing my bachelor's degree, and I have had same subject here for my master's degree. Back in my mid school, I've used a textbook which didn't have much illustration, whereas for my master's, I've used a textbook with full of illustration, authored by Dr. Frank H. Nutter, who is a surgeon and a medical illustrator. Learning with the help of illustration made a world of difference. It was much more comprehensible and easier to learn. I used to refer illustration before I went for any lectures or cadaveric dissection. Even while dissecting cadaver, it's not easy to differentiate and understand different structures, like arteries, veins, nerves, or any other small structures. Visuals go a long way aiding learning. And this is true for any other medical and scientific subjects. Illustrations can also play a role in weekly and daily lectures given out by professors across medical schools and scientific institutions. This is an example of a relatively complex theory called thyroid hormone synthesis. Now, this is an illustration I've created for the same concept. This was used by a professor in med school, and the feedback I received was great. Not only the learning part by students, but teaching was easy. A win-win situation. Studies have proved illustration helps in learning, reading, and it's helpful throughout education. Let me talk about medical art and technology. Now, influence of technology or adoption of technology has broadened the influence of this field. Technologies like 3D model, animation, mobile apps, gaming, so on and so forth, is revolutionizing the way we learn and train. A pilot, before being allowed to handle actual aircraft, would go hours and hours of training on a simulator. In the same way, now surgical residents are getting a chance to play with the rare procedures or play with the newest medical equipment. I'll show you a VR training tool which deals with, it's a simulation which deals with a rare but extremely dangerous situation in a hospital or operating room, a patient on fire. Now, as you can imagine, nobody is really trained how to deal with this because we cannot put a human being on fire and practice, right? I'll play the video and I'll talk a little bit about it. So, it's gonna take a while to play the video. This is a VR training tool which helps surgeons and other medical staffs in operating room to get trained dealing with operating room fire. It's developed by medical illustrators and other software engineers working in a company called Health Scholars. It's already being installed in different hospitals across the United States. Let's have a look at it.
Okay, I've made the initial incision and I'm ready to dissect tissue around the thyroid with the electrosurgical pencil. Anesthetist, what's the % oxygen going to the patient?
100% right now, doctor.
Oxygen is a conductor of fire. 100% is oxygen. That pencil,
I smell smoke.
in a proper
Does anyone
vessel,
see fire?
it produces spark.
Control the bleeding.
Yep.
Get the fire!
Doctor, I've stopped the flow of oxygen.
Okay, the fire is out.
Don't worry, that was just a simulation, not real fire. But it's a great training tool. It actually gives personalized feedback and scores at the end of that training tool. Let me talk about communication. Effective communication is another step towards reducing medical errors in hospitals. I'd like to talk about patient education here because it's often said in the hospital a well-aware or well-educated patient is the best patient. And by that, I mean this. Asking every question to Dr. Google might not be a good idea. But I would like to focus here myself on communication between medical staff and patients. Now, these are MRI image of a disease called brain aneurysm, a fatal disease characterized by dilation of blood vessels. It's often asymptomatic, meaning patients might not know whether they are affected or not. It's often diagnosed with the help of MRI and CT scans. Resulting images would look like this. Usually for a patient, these pictures means nothing. Even for doctors, those who are not closely associated with radiology might have hard time reading these type of pictures or images. We medical illustrators work closely with radiologists to bring up useful data from CT and MRI and that sort of images with the use of easy to read illustrations. I'll show you an example. Now on the right side is an illustration I've created from MRI brain aneurysm of a patient. We take it to different softwares and come up with a simple illustration. As you can see, the aneurysm is clearly depicted, different structures are being labeled, making it easier for the patient to understand the problem. Now this is a beautiful illustration, again explaining a treatment option called surgical clipping for the same problem, brain aneurysm. I'm using this illustration with the permission of Barrow Neurologic Institute and it was created by Peter M. Lawrence. We help to develop communication with patients. Patients gain deep understanding of problems and treatment. Thereby they will be equipped with right knowledge to deal with the problems at their hand. Medico-legal cases. Up to now, I have told you how medical illustration is helping or enhancing and empowering the knowledge of healthcare professionals, educators, and even patients. But the job doesn't stop there. If things go totally wrong and end up in a courtroom in front of a judge, you can be rest assured a judge is the best damn judge, not a doctor. And it is often a medical illustrator who visually explains the case in front of them. This is a sample illustration I've created a couple of years ago. Here the patient had a fracture of index finger bone. And patient went for first surgery. After the first surgery, the patient still had complaint of immobility. Patient went for 2 more surgical attempts, but no avail. Still the problem persists. Now patient is seeking compensation. This type of illustration would help the jury to understand the case better and also arrive at a quicker decision. And as a legal system, it's not only provides us justice, but also help in reducing such incidents in the future. Now let me ask you a question. A patient having complaint of nasal polyp came to the hospital, but ended up dying due to medical error. Can medical illustration help to avoid such situations? Maybe, maybe not. But this field is pushing the limits of creativity, technology, and medical knowledge with a constant aim of bringing up the quality of healthcare system and medicine. Words are important. If we use a wrong word in a wrong situation, it might end up a relationship for a lifetime. Words are important. So are pictures. Remember, one picture speaks for 1,000 words. And I believe these are the type of pictures or art which have the potential to save lives. Thank you.